Hello, my name is Mike Sakmar. I come from Johnstown, Pennsylvania. Currently, I'm unemployed, and for a good reason, I'd like to thank the Johnstown Free Medical Clinic for the prescription medicine I'm on, a maintenance medicine. Cough, cold, so on and so forth. In this area, folks like me would have to depend on the Johnstown Free Medical Clinic. The concerns I have is in our area, we're fortunate to have the volunteers of the doctors and their staff to provide free coverage. And the medicine I get comes from the pharmaceutical company, which kind of gets me to really think and open my mind is maybe a county or two away, they don't have a free medical clinic. What do these folks do that don't have medical insurance to get them on track and be physically fine? The other thing is too is I worry that if something major would happen to me, I feel that if it's surgery or a major accident done, the health care would be provided, but who then pays the bill? Do I go into debt the rest of my life? Is the hospital stuck with being that a person or a patient can't pay the bill? And if it's just one person like me, how many did they see over a period of year? So that's the concerns I have is while you're fine and healthy right now, you just want to prepare for when you really and hopefully don't need to use something major. A recommendation or request for the governor is possibly somebody gets health care, if it would be major, provided, but somebody's left holding the bag. What I recommend is there would be a kitty or poll, maybe the half percentage of the sin tax, put in a poll to provide that coverage or basic coverage for individuals of Pennsylvania. I know they have it for the children, so they don't go without health coverage, but it's the adults. I've worked for companies as being employed. It was still it was prohibitive to afford their coverage, although it was a company plan. And other companies I worked for did provide partial co-payment on the plan. It's just expensive, and the average person, depending on what job they have, just can't afford it. I'd recommend that the funding be from a percentage of the sin tax or something to say, hey, we got to get our citizens of the state coverage. Everybody should be covered if they don't have medical coverage.